So Scott Moe just did an interview with Rebel News, because apparently that's where Saskatchewan premiers go for hard-hitting journalism now, and casually dropped hints about privatizing healthcare without actually using the word privatization. It's like breaking up with someone by saying you want to see other people but insisting you're totally still committed to the relationship. Classic political move. Welcome back to Canadian Insights, where prairie premiers are playing footsie with private healthcare and pretending nobody notices. Today we're breaking down Scott Moe's very careful word salad about innovative healthcare delivery, why the NDP is losing their minds over it, and what Alberta's Bill 11 has to do with any of this. Buckle up, because this is healthcare privatization discourse disguised as policy innovation, and it's exactly as sketchy as it sounds. Alright, let's set the scene. Scott Moe sits down with Rebel News for a year-end interview, which is already a choice, and starts talking about how healthcare access is the top issue facing Saskatchewan in 2026. Fair enough, healthcare is a mess pretty much everywhere in Canada right now. Wait times are brutal, staffing shortages are real, people are frustrated. So Moe says the province is doing more hiring, which sounds good, and then he drops this gem. He says over the next few months there will be a very open discussion about delivering healthcare in a very innovative way, and oh by the way, you're seeing some of this in Alberta too. Cue the alarm bells, because when a Conservative Premier says innovative approaches while gesturing toward Alberta, what they really mean is privatization. They just don't want to say the P word out loud because it polls terribly. Now, why does mentioning Alberta matter? Well, Alberta just introduced Bill 11, which is basically a roadmap for two-tier healthcare. This bill would allow doctors to bill the public system and also charge patients directly for non-plan services. It would let employers offer private health services to employees through their health plans. In other words, if you've got a good job with a fancy benefits package, you can skip the line and get faster care by paying extra. If you don't, well, enjoy the waiting room with everyone else. It's the healthcare equivalent of airlines creating premium economy, where some people get slightly better treatment because they can afford it while the rest of us are crammed in the back eating stale pretzels. So when Moe references what's happening in Alberta and talks about innovative approaches, the NDP hears privatization dog whistle and they are not here for it. Carla Beck, the Saskatchewan NDP leader, came out swinging. She said it's pretty clear that Alberta intends to allow private health insurance and a two-tier system, and that Scott Moe maybe lacks the courage to use the word privatization, but that's exactly what he's talking about. She's calling him out for trying to have it both ways, talking about fundamental changes to healthcare delivery without being honest about what those changes actually mean. And honestly, she's not wrong. If you're going to completely reshape how healthcare works, at least have the guts to say what you're doing instead of hiding behind vague language about innovation. Beck also threw down the gauntlet and challenged Moe to come back to the legislature and have this open discussion he keeps talking about. She wants him to spell out exactly what he's planning, in public, on the record, where he can be held accountable. Because right now, Moe's strategy seems to be floating trial balloons in friendly media interviews, gauging public reaction, and maintaining plausible deniability. It's the political equivalent of testing the water with your toe before diving in. You get to see if people freak out without fully committing to the dive. Smart politically, but also kind of cowardly if we're being honest. The NDP is also raising a bigger, more sinister question. Are the Saskatchewan Party and Conservatives across the prairies deliberately letting public health care collapse so they can justify privatization? It's a conspiracy theory, except it might not actually be a conspiracy. Think about it. You underfund the system, you don't address staffing shortages adequately, you let wait times balloon, you create an environment where people are desperate for any solution. And then you ride in like a hero with private options that will totally fix everything, trust us. It's manufactured crisis followed by predetermined solution. And the kicker is, privatization doesn't actually fix the underlying problems. It just creates a faster lane for people who can pay while making the public system even worse for everyone else because you're pulling resources, staff, and funding into the private tier. Now, let's talk about what Alberta's Bill 11 actually does, because this is the model Moe seems interested in. The bill allows physicians to work in both the public and private systems simultaneously. Sounds reasonable on the surface, right? Doctors can maximize their income, patients get more options, everyone wins. Except here's what actually happens. Doctors, who are rational economic actors trying to maximize their earnings, will prioritize private patients who pay more. Public patients get pushed to the back of the queue. And because the same pool of doctors is now split between two systems, the public system gets even slower. It's not creating more capacity, it's just redistributing existing capacity based on ability to pay. That's not innovation, that's just inequality with extra steps. The bill also lets employers offer private health services through employee health plans. This creates a workplace hierarchy of healthcare access. If you work for a big corporation with good benefits, great, you get expedited care. If you work for a small business, are self-employed, unemployed, retired, or work part-time, sorry, you're stuck in the regular system that's now even more underfunded and understaffed because resources have been siphoned off to serve people with private coverage. It's a recipe for a fundamentally unequal healthcare system where your zip code and your paycheck determine how quickly you get treated. That's not the Canadian way, or at least it's not supposed to be. Saskatchewan NDP health critic Pierre Conway jumped into the fray too, warning that allowing private insurers to get a foothold in healthcare should concern all Canadians, not just people in Saskatchewan. And she's absolutely right about that. If Saskatchewan and Alberta go down this road, other provinces will follow. Manitoba's probably watching. Ontario's Conservatives would love this. Before you know it, public health care as we know it is getting chipped away province by province, replaced by a patchwork system where quality of care depends on wealth. And once that genie is out of the bottle, it's nearly impossible to put back. Look at how hard it is to expand public health care to include things like dental or pharmacare. Now imagine trying to claw back privatized services once they are established. Not happening. Conway also pointed out that Moe refused to commit to not following Alberta's example during the last legislative session. He was asked directly, will you pursue something like Bill 11 in Saskatchewan, and he wouldn't rule it out. That non-answer is an answer. If he had no intention of privatizing, he would have just said no. Politicians avoid giving clear answers when the honest answer would be unpopular. So by refusing to rule it out, Moe essentially confirmed that privatization is on the table. He just doesn't want to own it publicly until he's sure he can sell it. Here's the frustrating part about this whole debate. There are legitimate problems with Canada's healthcare system that need addressing. Wait times are too long. Rural areas are underserved. We have doctor shortages. Emergency rooms are overwhelmed. These are real issues causing real harm to real people. But privatization isn't the solution. Study after study shows that two-tier systems don't reduce wait times for the public tier, they just create faster service for those who can pay. The actual solutions involve proper funding, better retention of healthcare workers, improved infrastructure, more medical school spots, streamlined licensing for foreign-trained doctors, and addressing the systemic issues that make healthcare jobs so difficult. But those solutions require investment, political will, and time. Privatization is the quick fix that sounds appealing but ultimately makes things worse for most people. And let's be real about why conservative premiers love the idea of private healthcare. It's not really about patient outcomes or system efficiency. It's ideological. They believe that market solutions are always better than government programs, that competition drives excellence, that private enterprise is inherently more efficient than public service. And sometimes that's true. But healthcare isn't widgets. It's not a commodity where normal market forces produce optimal outcomes. People can't shop around when they're having a heart attack. They can't negotiate prices when their kid needs emergency surgery. The profit motive in healthcare creates perverse incentives to overtreat wealthy patients and undertreated poor ones. It's a market failure waiting to happen. So when Scott Moe talks about innovative approaches and open discussions, what he's really doing is softening the ground for changes that would fundamentally alter Canadian healthcare. He's testing the waters, using euphemisms, and trying to make privatization sound reasonable and modern rather than what it actually is, a betrayal of the principle that healthcare should be based on need, not ability to pay. And by doing this interview with Rebel News rather than mainstream outlets, he gets to speak to his base, the people most likely to support privatization, without facing tough questions from journalists who might push back. The NDP's response here is important because someone needs to call this out clearly. If the Conservatives get away with reframing privatization as innovation, if they successfully rebrand two-tier healthcare as patient choice, then we'll wake up one day in a country where your income determines your health outcomes even more than it already does. And once that happens, there's no going back. So Beck and Conway challenging Moe to be honest about his intentions, demanding legislative debate rather than media trial balloons, that's exactly what opposition parties should be doing. Holding government accountable, demanding transparency, making sure changes this significant happen through proper democratic processes rather than stealth policy shifts. The province's response to all this was predictably vague. They said they'll continue to pursue innovative approaches to healthcare delivery. Notice they didn't say we're not privatizing. They didn't say public healthcare is safe. They just repeated the same meaningless buzzword about innovation. When politicians refuse to give straight answers, it's because the straight answer would be unpopular. Saskatchewan's government knows that if they came out and said, yes, we're introducing private healthcare options that will create a two-tier system, people would riot. So instead they use soft language, test the waters, move incrementally, and hope that by the time people realize what's happening, it's too late to stop it. Here's what Saskatchewan residents should be watching for. Any legislation that allows doctors to bill publicly and privately. Any changes that let employers offer private health services. Any moves to allow private insurance companies into the healthcare space. Any language about patient choice or innovative delivery models. These are all Trojan horses for privatization. And if you care about maintaining a healthcare system where everyone gets treated based on need rather than wealth, now is the time to make noise about it. Because once these changes start, they're incredibly hard to reverse. So Scott Moe wants to have an open discussion about healthcare innovation. Great. Let's have it. But let's use honest language. Let's talk about what privatization actually means, who it benefits, who it harms, and what the evidence shows about two-tier systems. Let's have that discussion in the legislature where it belongs, not in friendly media interviews designed to avoid scrutiny. And let's be clear about what's at stake, the future of Canadian healthcare and the principle that everyone deserves quality care regardless of their bank account. Alright, that's the story of Scott Moe's not-so-subtle hints about privatizing Saskatchewan healthcare and why the NDP is sounding the alarm. If you found this breakdown valuable, smash that like button and let me know you want more deep dives into policy issues that actually matter. Subscribe because we're covering this story as it develops, and trust me, it's developing. Drop a comment and tell me, are you worried about healthcare privatization, or do you think competition would improve the system? I want to hear your take. And share this with anyone who cares about the future of Canadian healthcare, because this affects all of us. Until next time, stay informed, stay skeptical, and stay ready to defend public healthcare because it's under attack whether politicians want to admit it or not. Catch you in the next one.